Okay, so this is my lymphatic flow project. We'll just start here at this general diagram of the lymphatic system. So here we have our right lymphatic duct, and then this side is the thoracic duct. And then this also just shows some of the main lymph node groups. So we have the cervical nodes up by the neck, the axillary nodes, and then the inguinal nodes. And then so we'll start over here with the lymphatics of the lung. I split these into the right and left lung, and so for the right lung, the flow starts off all three lobes of the right lung drain into the intrapulmonary lobes, and then it moves to the hilar nodes. Then it goes to the carinal nodes, then to the paratracheal nodes, and lastly the flow goes to the brachiocephalic vein through the scalene node and goes into the right lymphatic duct. For the left lung, the lobes drain differently, so the upper lobe drains to the intrapulmonary and hilar nodes, then goes to the carinal nodes, the left superior paratracheal nodes, the brachiocephalic vein, and then to the thoracic duct. And then the lower lobe drains to the pulmonary and hilar nodes, the right paratracheal nodes, and the brachiocephalic vein, again through the thoracic duct. Then we'll go to the breast, and then I split this one into three main lymph node groups here. So first we have the axillary lymph nodes, and this is also known as like the primary lymph node group or pathway in the breast. And it's the primary deep lymphatic drainage, and it drains to the ipsilateral axilla. And then there are three major sections of the axillary lymph nodes. We have levels 1, 2, and 3. And level 1 is most often the first spot of drainage from the breast, and then from there it continues in order drainage-wise from level 1 to 2, 3. And then there's the internal mammary lymph nodes, and these are located in the parasternal space, embedded in the fat and the intercostal spaces. You'll find most of these lymph nodes in the first, second, and third intercostal spaces, and tumors in the inner quadrant have a higher chance of internal mammary lymph node involvement. And then lastly, we have the supraclavicular lymph nodes, and these are located in the supraclavicular fossa. And this provides drainage for the internal mammary lymph nodes and the axillary lymph nodes. Centrally located tumors directly drain to the supraclavicular lymph nodes. Next, we will go to the large bowel, and so here we'll start off with the colon, move to the rectum, and then finish with the anal canal. And so the right colon, you can see here, it follows the superior mesenteric vessels, which includes the ileocolic and right colic nodes. The left colic follows the inferior mesenteric vessels, and then the regional nodes there are the mid-colic, inferior mesenteric, and left colic nodes. For the sigmoid region, this area drains into the inferior mesenteric system, and it includes nodes along the superior rectal, sigmoidal, and sigmoidal mesenteric vessels. And then moving to the rectum, for the upper rectum, it follows the superior rectal vessels into the inferior mesenteric system. And then for the middle and lower rectum, this follows the middle rectal vessels, and the internal iliac nodes are the principal nodal group. Also for some tumors that are located in the lower rectal area, like very low, that extend to the anal canal, they can drain to the inguinal lymph nodes. And then lastly, we have the anal canal. And so if there is cancer in this area, initial spread will occur to the pararectal and anorectal lymph nodes. And then tumor can spread to the internal iliac and lateral sacral nodes if it is above the dentate line, and then if it's below the dentate line, the tumor can spread to the inguinal lymph nodes. Okay, so going to the head and neck, there are a lot of lymph nodes here. I think I read somewhere that the head and neck region has almost a third of the lymph nodes in the body. And so I just highlighted a few here. So we have the superficial cervical lymph nodes, the occipital lymph nodes, and these provide afferent flow to the superior deep cervical nodes. The retroauricular lymph nodes, these drain regions of the scalp, auricle and EAM. Deep cervical lymph nodes, the deep parotid lymph nodes, and these drain the nose, eyelid, frontal, temporal scalp, EAM, and the palate, and they also provide afferent flow to the superior deep cervical nodes. You have the submaxillary lymph nodes. These are in the face, and they go from the groove between the nose and cheek to the zygomatic arch. The submandibular lymph nodes, these drain a lot. They drain the scalp, nose, cheek, floor of the mouth, anterior 2/3 of the tongue, gums, teeth, lips, frontal, ethmoid, and maxillary sinuses. And then you also have the buccal lymph nodes, which drain the eyelids, nose, and cheek. Retropharyngeal lymph nodes. And then the jugular digastric lymph nodes, which drain the tonsils and tongue. Okay, moving on to the male pelvis. I split this one up basically into testicular cancer and prostate cancer. So for testicular, the lymphatics from the hilum of the testes accompany the spermatic cord to the internal inguinal ring of the testicular spermatic veins, which then it drains into the retroperitoneal lymph nodes. And then the left and right side drain differently. The left side drains to the left renal hilum, and the right side drains to the pericaval lymph nodes. And then from the retroperitoneal lumbar nodes, drainage occurs through the thoracic duct to the lymph nodes in the mediastinum, supraclavicular fossa, and sometimes to the axillary nodes. So that's how that can metastasize far away. And then for prostate cancer, the lymphatic spread is usually very orderly. It starts in the perioprostatic and obturator nodes, goes to the external iliac nodes, to the hypogastric nodes, common iliac nodes, and then to the periaortic nodes. And then lastly, we have the female pelvis. Again, I kind of split it into 3 different cancers. We have cervical cancer, endometrial cancer, and ovarian for cervical. And generally in the pelvis for the female, the order for lymphatic drainage is, again, very orderly. And so it starts in the parametrial nodes, goes to the pelvic nodes, the common iliac nodes, periaortic nodes, and then the supraclavicular nodes. For endometrial, the lymphatic spread starts in the internal and external iliac pelvic nodes, and then it spreads to the periaortic nodes. And then for ovarian cancer, spread can happen to the pelvic and para-aortic lymph nodes. That's common for ovarian cancer, though. A lot of times the cancer spreads through seeding and just directly through metastasis. But yeah, that is my lymphatic project.